Hey, welcome back viewers. So today our topic for discussion is axillary artery. So this being one of the frequently asked question, so we will discuss the anatomy of this axillary artery in detail in a easy way. Okay. So we are going to discuss this axillary artery under these following headings, that is the location, its extent, its parts, its relation, and finally of course the branches. So, where is the location of this axillary artery? So, as the name suggests, the axillary artery is located within the axilla. So, it is one of the important content in the axilla. So, when we do the dissection of the axilla, we will come across this axillary artery. Next, what is the extent? So, from which artery this will begin and up to which artery this will extend. So this axillary artery begins as a continuation of the third part of subclavian artery, and this will continue beyond the teres major as the brachial artery. Okay. So at which point it will begin as a continuation of the third part of the subclavian artery is at the level of outer border of first rib. And up to the lower border of teres major. So below the lower border of teres major muscle, we will call it as brachial artery. Okay. So if somebody is asking you what is the extent of this axillary artery, you have to tell them like the axillary artery, it begins as a continuation of the third part of the subclavian artery at the outer border of first rib, and it will continue up to the lower border of teres major, beyond which this will continue as the brachial artery. Okay. So we will see. This is the first rib. Okay. This is the first rib, and here you have got the teres major, tendon of teres major. Okay. So as I told you, it begins as a continuation of the third part of the subclavian artery. So this is the subclavian artery, third part of subclavian artery. So the axillary artery will begin from here, from the outer border of first rib. Okay. And it will extend up to the lower border of teres major, lower border of teres major. So below this, it will continue as the brachial artery. So this part which is there is what we are actually referring to as the axillary artery. Okay. So hope the extent is clear now, from the outer border of first rib to the lower border of teres major. So it begins as a continuation of the third part of subclavian artery, and it will continue as the brachial artery below the lower border of teres major. Okay. So now coming to the parts. So this axillary artery, it is divisible into three parts by one important muscle, key muscle of this region. So you have got the pectoralis minor muscle. So this is the pectoralis minor muscle, which is dividing this axillary artery into three parts. So the part above the pectoralis minor is called as the first part. Okay. And the part which is present behind this pectoralis minor is the second part, and the part of the axillary artery which is present below the lower border of pectoralis minor is the third part. Okay. So by the presence of the pectoralis minor, it is divisible into three parts, that is first, second and third parts. So first one is above the upper border of pectoralis minor, second part is behind the pectoralis minor muscle, and third part is below the lower border of pectoralis minor muscle. So by the presence of this pectoralis minor, this axillary artery is being divided into three parts. Okay. So now we will have a look at the relations of each part. So initially we will talk about the relations of the first part. Okay. So relations of first part. I'll tell you an easy way to draw the diagrams for the relations. You can mark it like this, for clarity. Anterior, posterior, this is medial and this is lateral. So whatever you're drawing this side is medial relation, whatever you're drawing this side is lateral relation. Whatever you're drawing here is the anterior relation and whatever you're drawing below is the posterior relation. So relations of the first part. So relations of the first part, we all know there will be a skin, okay, skin and superficial fascia, okay, and then you will have the pectoral fascia, then important muscle which is present here. We represent the muscle like this. This is pectoralis major. So as a whole, this axillary artery throughout its course, it is accompanied infero-medially by the axillary vein. Irrespective of its parts, throughout its course, the axillary artery is accompanied infero-medially by this axillary vein. And in the upper part, this axillary artery as well as the axillary vein, they are enclosed within a sheath which is called as the axillary sheath. Okay. So this axillary sheath which encloses the proximal parts of the axillary artery and vein, it is derived from the prevertebral fascia, which is nothing but the deep fascia of the neck, which will extend over these vessels as a sheath in order to provide protection and in order to provide space for this axillary vein to expand during increased venous return. So this will provide a space for the axillary vein to expand when there is an increased venous return. Okay, so that is the function of this axillary sheath. This axillary sheath, I repeat, it is derived from the prevertebral fascia, which is nothing but the extension of the deep cervical fascia. Okay, so as I told you, this axillary artery which is there, it is accompanied by the axillary vein medially. Okay, so we will draw the vein here. So this is the axillary vein and this is the first part of axillary artery. So anterior relations for the first part are skin, superficial fascia, pectoral fascia and the pectoralis major muscle. So coming to its posterior relations. Posterior relations, you have got the first and second digitations of serratus anterior. First and second digitations of serratus anterior muscle. Okay. So that is the posterior relation. And apart from this, in the posterior part, you have got the medial cord of the brachial plexus. So this axillary artery, it is related to the cords and branches of the brachial plexus. So this is the medial cord of brachial plexus. Okay. And then coming to its lateral relations. Lateral relations, it is related to the lateral and posterior cord. So this is the lateral cord of brachial plexus and this is the posterior cord of brachial plexus. Lateral and posterior cords of brachial plexus. Now this medial cord will give the medial pectoral nerve and this lateral cord will give the lateral pectoral nerve which will supply the pectoralis major, and these two have got a loop of communication. These two are communicated by a loop. So that loop of communication will form the anterior relation to the first part. So now with this we'll just have a look once more. Okay. So anteriorly it is related to the skin and superficial fascia and it is related to the pectoral fascia and pectoralis major muscle and to the clavipectoral fascia, and it is related to a loop of communication between the medial and lateral pectoral nerves. Medial and lateral pectoral nerves. So this is the medial pectoral nerve and this is the lateral pectoral nerve and this is the loop of communication. So those are the anterior relations. Posteriorly, it is related to the medial cord of the brachial plexus and to the first and second digitations of serratus anterior muscle. And medially, it is related to the axillary vein. This is the axillary vein. And laterally, it is related to the posterior and lateral cords of the brachial plexus. So, this is the relations of the first part of the axillary artery. Now, we'll have a look at the relations of the second part of axillary artery. So, second part. When we talk about the second part, okay. So, let it be first, second, third. Anyways, it is always medially related to the axillary vein. That was what we were actually thinking, right? So, it is medially related to the axillary vein. This is the axillary artery and this is the axillary vein. Coming to its anterior relations. Anterior relations, apart from the skin, superficial fascia and this pectoralis major muscle, you have got one more muscle, that is pectoralis minor. This is pectoralis major and this is pectoralis minor, which forms the anterior relation. Okay. And posteriorly, it is related to the posterior cord of brachial plexus and to the subscapularis muscle. This is the subscapularis muscle. Okay. And this is the posterior cord of brachial plexus. And laterally, it is related to the lateral cord of brachial plexus. And medially, it is related to the medial cord of brachial plexus and of course the axillary vein. Okay. So, the cords of brachial plexus, if you understand, they are given their names in relation to the second part of axillary artery, in relation to their positions, in relation to the second part of axillary artery. So, the cord which is present medial to the second part of axillary artery, we are calling it as medial cord. The cord which is present posterior to the second part of axillary artery, we are calling it as posterior cord. And the cord which is present lateral to the axillary artery, we are calling it as the lateral cord. Okay. So, I repeat the relations. Anterior relations, skin, superficial fascia, pectoralis major, pectoralis minor muscle. Posterior relations are subscapularis muscle and posterior cord of brachial plexus. Medial relations are medial cord of brachial plexus and the axillary vein, and lateral relation is the lateral cord of the brachial plexus. Okay, so this completes the relations of the second part. Now, moving on to the relations of the third part. So, when we move on to the third part, these cords which are there, they are giving off their branches. They will give off their branches. So, those will form the relations. Okay. So, the relations in the third part. Let's see. Anteriorly, it is related to pectoralis major muscle. Okay. And then posteriorly, it is related to subscapularis muscle and one more muscle, that is teres major and even to latissimus dorsi. Okay. So, anteriorly, it is related to pectoralis major and posteriorly, it is related to subscapularis muscle and teres major. And the two branches which are given off from the posterior cord of brachial plexus, that is the radial nerve and axillary nerve. Okay. So, these are the posterior relations. Next, coming to the lateral relations. So, laterally it is related to the lateral root of median nerve, musculocutaneous nerve and coracobrachialis muscle. So, this is coracobrachialis muscle and this is the musculocutaneous nerve and this is the lateral root of median nerve. Okay. So, these are the lateral relations of the third part of axillary artery. Next, coming to the medial relations. Medial relations. So, medial relations, if you see, in between the axillary artery and the axillary vein, you will have the medial cutaneous nerve of forearm. Medial cutaneous nerve of forearm. And deep to this, you have got the ulnar nerve. Ulnar nerve. And attached to the anterior wall of this axillary vein, you will have the medial cutaneous nerve of arm. Nerve of arm. Okay. So, let's repeat all the relations once. So, anteriorly it is related to pectoralis major. Posteriorly it is related to subscapularis muscle, teres major and latissimus dorsi. And two nerves, that is the radial nerve and the axillary nerve. Laterally it is related to the lateral root of median, musculocutaneous nerve and coracobrachialis muscle. And medially it is related to the axillary vein, and in the gap between the axillary artery and the vein, it is related to medial cutaneous nerve of arm, forearm and ulnar nerve. Okay, so this completes the relations of the third part of the axillary artery. So now that we have completed the relations, we will have a look at the branches. What are the branches of this axillary artery? Okay, so as we all know, it has got three parts. First part, second part and third part. So first part will give rise to one branch, second part to two branches and third part to three branches. So what are those branches? So along the upper border of the pectoralis minor, the first part will give rise to a small branch, which is called as superior thoracic artery. Superior thoracic artery. So, this travels along the upper border of pectoralis minor, and in case of females, it will supply the mammary gland, and this will anastomose with the branches of internal thoracic artery and the upper intercostal arteries. Okay. So, the branch from the first part is superior thoracic artery. Superior thoracic artery. Next, we will talk about the branches which arise from the second part. From the second part, as I told you, there are two branches. So, first one is thoracoacromion branch. Thoracoacromion branch. Okay. So, first one is thoracoacromion artery. And the second branch, which runs along the inferior border of this pectoralis minor, is the lateral thoracic, or sometimes it is also referred to as long thoracic artery. Lateral thoracic or the long thoracic artery. So these are the two branches of the second part of axillary artery. So this thoracoacromion artery which is there, it will pierce the clavipectoral fascia, and it will divide into four branches which are placed at right angles to each other. They are placed at right angles to each other. So one will be reaching the clavicle, one will be reaching the acromion process, one will be reaching the deltopectoral groove. Okay. So the four divisions: pectoral, acromion, clavicular and deltoid. So I generally remember them like packed. PACD, packed. The four divisions of this thoracoacromion artery. PACD, packed. Okay. So the four divisions. So this is the acromial branch. This is the clavicular branch. This is the deltoid branch, and then you have got one more branch, that is the pectoral branch. They are present at right angles to each other. So the clavicular branch will supply the sternoclavicular joint, and it will supply the subclavius muscle. Okay. So this is the clavicular branch. And this is the acromion branch, which will travel up to the acromion process of the scapula, where it will anastomose with the surrounding arteries. Next, you have got the deltoid branch. This is the deltoid branch. So this deltoid branch will reach up to the deltopectoral groove and it will supply the deltoid muscle and the pectoralis major muscle. And this is the pectoral branch which will run between this pectoralis minor and major above, and it will supply the two pectoral muscles. Okay, so that is about the thoracoacromial artery. So the four divisions, you remember them like PACD. Okay, and then the other branch of the second part is lateral thoracic artery. The lateral thoracic artery, it will travel along the lower border of this pectoralis minor. Okay, and in females it is large. And this will form the lateral mammary branches. Which will supply the lateral part of the mammary gland. Okay, so this is about the lateral thoracic artery. Next, moving on, branches of the third part. So this is lateral thoracic and this is the thoracoacromial. Okay, next moving to the three branches of the third part. So the third part gives rise to three branches. One is subscapular artery. Second one is anterior circumflex humeral. Third one is posterior circumflex humeral. Okay, so the third part will give rise to a subscapular artery, which is a fairly large branch. When compared to the remaining branches, this is a fairly large branch. Okay, and this will give rise to one circumflex scapular artery. Which will take part in the scapular anastomosis. Okay, so this is the subscapular artery, which is a fairly large branch of this axillary artery, and this travels along the subscapularis muscle. So that is how it has got its name as subscapular artery, and this finally will anastomose with the branches of the lateral thoracic artery and with the branches of the intercostal arteries which are present over there. Okay, so this circumflex scapular artery, which is given off by this subscapular artery, will take part in the formation of the scapular anastomosis, and this will travel through the triangular space. Okay, next, anterior and posterior circumflex humeral. So anterior circumflex humeral and posterior circumflex humeral. So these will travel along the surgical neck of the humerus. So the anterior circumflex humeral will travel along the anterior surface of the surgical neck of the humerus, and finally it will anastomose with the posterior circumflex humeral artery, which comes from the posterior part. So suppose this is the humerus. So you will have one artery like this and one artery coming from behind. So this is the anterior circumflex humeral, and the one coming from behind is the posterior circumflex humeral. Finally, they will anastomose. Okay. So this anterior circumflex humeral, it will give rise to one ascending branch which will supply the humerus and the shoulder joint. And this posterior circumflex humeral, it is a large branch in comparison to the anterior circumflex humeral, and this is passing along the posterior part of the surgical neck of the humerus, and this travels through the quadrangular space, and this will finally anastomose with the anterior circumflex humeral, and this will give a descending branch which will anastomose with the deltoid branch of the profunda brachii. Okay, so finally if you see, all the branches of the axillary artery are taking part in anastomosis in order to maintain a collateral circulation. So this is about the total branches of the axillary artery. So I repeat, first part is giving rise to one branch, that is the superior thoracic artery, which travels along the upper border of pectoralis minor. Second part is giving rise to two branches, that is thoracoacromion, which pierces the clavipectoral fascia, and lateral thoracic, which travels along the lower border of pectoralis minor. And then the third part is giving rise to three branches, that is subscapular, which travels along the subscapularis muscle, and anterior and posterior circumflex humeral, which will travel along the surgical neck of the humerus. Okay, so this is in total about the anatomy of the axillary artery. So thank you all for watching.